The first one we're going to be presenting is the 3 phases of plan change, starting with unfreezing, which is where we're just talking about the change and why we're implementing it.
Okay guys, you know how we've been using the single swabs to swab the patients for COVID? We have done some research and decided that those are a little bit costly for only testing for one disease. So we found that there are actually a swab called a quad swab that tests for more diseases, and it's more cost effective for our organization. So we were thinking to implement those quad swabs instead. And I'm going to put this note in every pod at the ED so you guys know what's going on. And we'll have a little bit of a teaching moment during our shift report too. How's that sound?
What if I don't want to?
Well, we're just going to try it. It's more cost effective and we've done our research on it. And we're going to make sure everyone's taught on how to do it as well.
I guess. Fine. Okay, so for the next phase, we are doing the movement phase, which is developing a plan and implementing strategies.
Okay, so as I said, I'm going to have these flyers placed in every pod in the ED to make it clear what the expectation is now. And I also will kind of show you guys. So this is our new quad swab, but it's the same thing as the COVID swab. It just has 2 swabs instead of 1. But you're swabbing it in the nose the same way. It just tests for more diseases. Does that make sense?
Yep.
Okay.
Okay, so now we're in the refreezing phase where we're just implementing the change and making sure the change stays.
So we have the 2 swabs here, which the patient's obviously going to swab in their nose, and we're just going to use that instead of our single swab COVID.
Yeah.
And then this also tests for like flu, both flus, COVID, MRSA, like all those things. So.
Yes. Yep.
And we use it for every patient.
Yes. Correct.
Perfect. All right, so for our next scenario, we're going to do resistance to change, which shows that an employee isn't wanting to use the change because they do not have full trust in their manager.
Okay, so we're going to start using the quad swabs for the swabbing for COVID as well as some other diseases like flu and things like that. So that's going to be a little different than our COVID one. It's going to have 2 instead of 1. So we're going to use the quad swabs from now on instead of the single COVID swab.
Well, I'm still going to use the single quad or the single one because the manager doesn't know what she's talking about. So I'm not going to do it.
That's how you feel.
All right, now we're going to show you the trust phase of this scenario of when the employee trusts what the manager is saying in the change they're implementing.
Okay, so instead of the old COVID swabs that just test for COVID, we are going to implement a new quad swab, which is going to test for COVID as well as some other diseases like the common flu, MRSA, things like that. Okay. So that's going to have 2 swabs instead of 1.
Okay, then I'll make sure to do that from now on.
Thank you.
In this scenario, we're going to show the components of critical thinking that a manager should have. The components are insight, intuition, empathy, and then willingness to take action. So we're just going to be showing when a nurse comes to their manager asking for help and how that manager can help them.
So I have a patient that I'm taking care of, and their family's just being really disruptive, not letting me do my cares, questioning every single thing I'm doing, and not allowing the patient to get rest. I really don't know what to do. Do you have any insight?
In my experience, I think I have had to either tell the family respectfully they need to leave the room so you can get those cares done, or explain to them the importance of remaining respectful if they're going to be in the room, allowing you to get those cares done because they have to get done.
Okay, I'll try that and let you know how it goes.
Okay. Let me know if you need help, please.
10 minutes later, the nurse comes back.
All right, so they're still being really disrespectful, and I haven't been able to complete anything. Can you come into the room?
Yeah, let me come in there and help you.
Awesome, thanks.
This is Kelsie Kaufman. I'm going to be going over our payoff table scenario. We have recently seen a change in the hospital from blue IV start kits to orange IV start kits, tourniquets color. There has been tourniquets increasingly being left on patients' arms and causing injuries to this patient's arm. So with the hopes of changing from blue to orange, we will see it against the skin color better and take off the tourniquet to decrease chances of injury. If we see 90 patients per day every 31 days in the ER, we will compare the cost of the IV start kit compared to cost of treating the tourniquet injury. If our IV tourniquet costs $7 for the blue and we see 90 people per 31 days, we will be spending $19,530 in total for those IV start kits. Say we have 700 cases per year from injuries of the blue tourniquet being left on the arm. At a cost of $20 per person, we will be spending $14,000 to repair the injuries from the blue tourniquet. If we add the cost monthly of the IV start kits to the yearly cost of the injury treatment, it equals $33,530 on the start kits and the injuries. If we move over to the orange start kits, they are a cost of $5 per IV start kit. If we decrease our injuries in half with these orange IV start kits, equaling 350 cases, say we see 90 patients per 31 days in the ER per day per 31 days, our orange IV start at $5 will cost a total of $13,950 just for the IV start kits. $20 per 350 cases equals $7,000 total for these orange tourniquet injuries. If we take the cost of the IV start kits plus the cost of treating the injuries, that equals $20,950 on the start and the injuries. So comparing the two here, the orange IV start kits are not only going to reduce the injury rates, they're also going to reduce the cost per year on treatment.
Within this part of the video, we're going to be going over our critical thinking questions and discussing our answers and our rationales for the answers. Okay, so the first question is, a manager is sitting at their desk and 3 nurses come up asking for help. Which nurse should the manager help first? A, we have a nurse who needs help repositioning her patient that is due for Q2 turns. B, we have a nurse that has been trying to get an IV stick so she can get her patient started on IV antibiotics. Or C, a nurse wants to take her break but wants to make sure her patients are going to be taken care of.
I think the answer would be B.
Yeah.
The nurse who is trying to stick their patient for an IV antibiotic.
But Q2 turns are also important. You don't want them to get like pressure ulcers. So.
True. I just feel like with that one, you could ask like another nurse, where a manager might be more skilled in getting like IV sticks if they're like known for it. Okay. So B, the nurse should see this patient first because we want to make sure the patient is getting their antibiotics. While nurse A can always ask another nurse or PCT, and nurse C can take her break as long as the tasks are completed, and she can always go and ask other nurses to make sure they're being taken care of. 2, making a decision. Okay, question 2 is, when we are trying to make a decision, there are multiple different decision modules or making tools that can be beneficial. They could either be payoff tables, consequence tables, or logic models, which are just different types. So our scenario is a hospital is trying to get new IV bands, and they're switching from an orange IV band to the blue IV band. The blue bands have been getting left on patients, causing skin tears to be on each patient that it gets left on. The hospital is trying to weigh their options on if it would be cost effective to switch. To figure out what they want, they need to look at the financial effect, how much time it would take to implement the change, and if people would be willing. So out of our 3 options, what do we think would be the most beneficial?
I think we should use the payoff table because they'll help us like figure out the best what's more cost effective.
What is a payoff table?
So a payoff table, you're looking at all of the data that comes in, the history of the data, looking at the probabilities, and it kind of just gives you like a way to like visualize it all within like one schematic.
I would say payoff table too then.
Yep, payoff table. So question 3 is how can you avoid employee and manager mistrust in the workplace when it comes to change?
I would say you want to have open communication. That's like really important. And then everyone needs to obviously take part in that open communication.
Be responsible for your own actions.
And then making sure there are like times for questions to come from the employees, because as we know and as we've learned, employee mistrust is one of the most common reasons for resistance to change. So if we can prevent that, then it can lead to more change being able to be implemented. Question 4 is what are driving and restraining forces for an incentive pay weekend program? So what's something that could drive employees to want to be part of like a weekend pay program?
An increase in pay, having more free time during the week, spend with family and friends, do whatever you want during the week.
And what about like a restraining, something that would like hold them back?
Like not having enough time with family or friends.
Yeah.
Like not having your free time over the weekend.
And then question 5, or what are some ways that a manager or a change agent can help stabilize the change during the refreezing phase of plan change? So like refreezing is just how we're kind of like implementing it and how we're starting to discuss that change is going to be happening to our like employees.
Make sure that the person who is actually implementing the change is willing to stay within the organization for at least 3 to 6 months, because they say that's how long change takes to really stick.
The person should also be really open to feedback from the employees, because if they're closed off, then obviously the change is just not going to stick.
And then remain involved.